It is estimated that nearly 1/3 of Americans comparison shop for health care, but few people have a full understanding of basic insurance concepts such as deductibles, coinsurance, and out-of-pocket pays. Joining us now with money-saving tips and advice to clear up any confusion is Rebecca Madsen. She's the Chief Consumer Officer for United Healthcare. Good morning to you.
Good morning. Thank you for having me here.
Good to have you join us. Let's talk first about open enrollment. I think a lot of people wonder, what is that exactly? How does it apply to me, and when does it start?
Yeah, open enrollment starts in the fall, and if you're an employer plan, the majority of employers have open enrollment in the fall. If you're a senior in a Medicare plan, Medicare starts October 15th, and it's the time of year where people can really spend a little bit of time to pick their health benefits for the coming year. We know that 1 in 4 people, believe it or not, would rather do their taxes than go through open enrollment. And we know that's because it's a little bit confusing for people. They don't understand the terms, so we're hoping to simplify that today.
Yeah, I think anything you can do to simplify that process is helpful. In terms of employers, what should they be thinking about or doing when it comes to offering health benefits to their employees, rather?
Is the employer, in addition to looking at the cost and the carrier and the type of plan, there's things that employers can overlook that are really beneficial to them and their employees. Things like dental and vision benefits. In addition to just getting your glasses or getting your fillings or your teeth clean, you can get a vision exam and detect diabetes. You can get just a routine dental exam, and they can find issues with your overall health. We know oral health and heart health are very closely linked. And so looking at programs like that, as well as wellness programs. Happy employees and healthy employees go hand in hand, but taking the time to actually say, hey, is there a wellness option? It can offer incentives to your employees, but it also makes you have a more productive workforce and can, in the long run, lower your health care costs if you have healthier employees.
How can people save money when it comes to choosing a health plan?
Yeah, there's a number of ways. The first thing is make sure that your provider is in the network. You know what doctors you go to for the most part. When people go out of network, it's substantially more expensive. And about 2/3 of people don't know they're even doing that. So look and make sure that your provider is covered and in the network. And the same with the medications you take. Medications are the most used benefit. So how do you spend the time to actually say, look what I'm taking, is it covered by my plan? You can also engage in wellness programs, and you don't have to be a healthy person to do it. That's a big misconception as well. If you get coaching, if you do fitness programs, if you go through consultations or counseling and advice from somebody like a registered nurse, if you have a history of heart disease, for example, you can earn money back, sometimes up to $1,500 a year. So that's another great way that you can save money. And then lastly, look and see if your employer offers an HSA. That's a health savings account. You put money in there pre-tax, the interest accrues without taxes, and you can pay it towards your expenses if it's a qualified medical expense. Again, no tax implications. So if you're in a 30% tax bracket, it's like getting a 30% discount on covering your medical costs.
You know, I've noticed, years ago, it used to be, you check this box, you're a smoker or a non-tobacco user, and that was about it. There are so many new trends, I feel like, in healthcare. What trends are you seeing?
Well, every year open enrollment's new because there's so many changes to the plans and all the terms we talked about, like deductibles. But wellness is really the space where we see a ton of growth. The importance in not only keeping costs low, but in understanding before an event happens. So taking somebody's health history, going through what we call a biometric screen, where you take basic information like weight and blood pressure and glucose levels. That helps employers and the insurance carrier help individuals because we understand their health status and can avoid an event happening by giving them proper diet, nutrition, and getting them into the right programs ahead of time. And this is really a big trend in the industry lately.
Great to talk to you this morning. Where can people go for more information?
There's a number of places they can go. We have one resource at uhc.com called Healthcare ABCs. As it sounds, it tries to take the information, key terminology, how you can go through open enrollment, and basic information and make it really simple so that it can help people have a greater understanding and really get to that percentage of the population that are not very familiar with their healthcare terminology and the open enrollment process.
Rebecca, thank you so much for your time today.
Thank you for having me here.
And especially as open enrollment approaches, you can get more information. Visit this website. It's uhc.com.